the data science alumni of AIM, as well as clinical epidemiologists from the University of the Philippines College of Medicine. I want to point out that in the many decades I have worked with data, one of the things that we know is no data set is completely free of errors. Errors can happen at any time. And especially in a case like this, when everything is new, it is a new virus, data starts sparse. And when we are collecting data from all corners of the Philippines, including from places where there are hospitals, in the middle of nowhere, where they not don't necessarily have Wi-Fi, there will be errors. One of the things we need to do is we know that there is a process for validation, and you need to decide where the validation. And very important when you use data is you always validate, and then when you come to the data that you can use, you ask yourself whether it is representative enough information. And in the case of the Department of Health, we have asked the Department of Health about any data that seems questionable. And third, the Department of Health does correct the data. And third, most important, did they have enough data and continue to have enough data to come up with valid results?
Thank you, Dr. Maya. Can we now have Dr. Rina from FASTER? Dr. Rina?
Yes, good morning, everyone. So I'm Rina Estuar. I am a professor in Ateneo de Manila University. I'm with the Computer Science Department, and I have been working on e-solutions since 2012, together with partners from industry and also with the Department of Health and PhilHealth. I agree with what Dr. Maya has mentioned. Initially, yes, when we do research and when we develop models, we really need good data. And good data comes from, of course, its source, which is data collection. So right now, I think the problem really is we get data from different sources from the ground, and the challenge is really to come up with a way to integrate the data for modeling. But it does not mean that it is not sufficient enough to do the models. The challenge is that the same health workers who are treating our patients are also probably the same people who will need to encode that data from the ground. So I guess there is really a need to increase manpower in the data collection part. And second, and all those who do modeling, we do know that the data that we have, there is a threshold that says the data is enough for modeling. And when we produce the models, we really have to put a score on its validity, its accuracy, and its precision. And so that's what we do with data science. Data science is very nice because even with sparse data, with varied data, with incomplete data, with the tools that we have now, it allows us still to develop operational models that can be used for decision making, as long as we put in the validation or the accuracy score. Thank you.
So thank you, Dr. Rina. I turn all this the forum for today will be managed by Dr. Carlos, who's going to have an initial set of questions for our experts, and then we can now have we can then open the floor for additional questions coming from our media partners. Carlos?
Thank you, Yusek. Thank you, Dr. Maya and Dr. Rina, for being with us today. So, a few questions lang po before we open the floor to our media partners. No? So, for the first question, can you enlighten our friends from the media how exactly your teams have been collaborating with DOH? Maybe we can start with Dr. Rina.
Okay. Okay, thank you. I am the project leader of FASTER. FASTER is the LGU monitoring platform that we have developed for the Department of Health. It is a platform that has been there since 2016. We have been developing disease models on dengue, measles, and typhoid together with our partners from Epidemiology Bureau, as well as our partners from KMITS of DOH. And so with this crisis, we revived the platform and provided a specific platform for COVID-19.
Thank you, Dr. Rina. Let's now go on to Dr. Maya.
Prior to COVID-19, I have been involved in helping the Department of Health primarily in the area of public and universal health care. I have done a lot of work helping PhilHealth with both finance or process and actuarial stuff. With COVID, I'm actually working with Rina's team in terms of converting the epidemiological forecast to health logistics requirements. I'm also working on with, as I said, a team including the UP College of Medicine professors.
Okay, thank you, Dr. Maya and Dr. Rina. Um, so both of our experts po that we have here today, they've been working with the Department of Health in ensuring that the data that we have would be used to guide the policy decisions that the DOH is making to ensure that our countrymen are well protected against COVID. So Dr. Rina and Dr. Maya, what precautions do we take and what best practices are observed in order to ensure the accuracy of the data that we use? Maybe we can start with Dr. Rina again.
Okay. Any researcher is trained naman to manage the data that comes in, no? So first, of course, there is the data collection part, where we have to make sure that there is consistency between the variables that receive the data and the actual data that comes in. So there is that is where we need a lot of review, and in data science, it's called data cleaning, where we make sure that the data it is fed in the model is correct and accurate. So there are automated processes that do that. There are also processes that do that. There's also expert validation. And so I think that's where our partners from Epi Bureau come in, no? So sila po talaga yung nagva-validate ng data coming from the different sources before it is actually used and fed into the models.
Thank you po. So Dr. Rina has just emphasized how important the data cleaning or the data validation verification is that we do here in the DOH. Dr. Maya?
Yeah. So one of the things we always do, regardless of where the source of data is, and I can assure you, even with data from very large, very
Hello, I can't quite hear the. You may need to repeat. Sorry.
Okay. So one of the things that we always do, as Rina said, with the data, is we validate the data before we use it. Can you hear me?
Patulong na lang po to whoever can type in the chat what is being said. I can't hear.
Carlos? Carlos?
Yes po, Yusek.
Ipakiayos mo because Dr. Arina, can you hear me now? Dr. Arina?
Doc Rina, can you hear us po?
I think si Dr. Arina ang may problema. Carlos, you call her and have it fixed
Yes,
na lang, and then we'll have Dr. Maya continue on with her answer. Sige, Dr. Maya.
Okay. So, ito po, even if our data comes from large private organizations who have much better, let's say, systems and facilities, I assure you there are always questions. So what do we do? First thing we do is we validate the data. And then the data that doesn't pass our validation, we give them back to the data owners. In this case, the people from the Department of Health. And we say, okay, here's what we found. Please investigate it. In the meantime, what we do is we take the rest of our validated data. So everything that passed our validation, and we ask ourselves, is that enough data in order for us, okay, in order for us to continue and make good analysis? Okay? And when we get good analysis, we continue with that. And then once we get the additional validated data, we go back and then we reanalyze. I cannot overemphasize the fact, okay, that in research, there is a continuation of research. So you do your analytics, and then when you get more data, you get more science. This is what's happening with this new virus. We are learning. But the important thing is that as we are learning, we are discovering new things. And we never move forward unless the data that we have validated is enough to give us good analytics and good conclusions.
So, Carlos? Carlos?
Yes po.
Carlos?
Yusek, yes po, here po.
Can I have an additional question kay Dr. Maya lang, since she said that, Dr. Maya, you said that ito pong ginagamit na hindi kayo tutuloy hanggang hindi validated ang data. Hindi kayo tutuloy hanggang hindi nyo nasisiguro na accurate at validated ang data nyo. Tama po ba yun? So ngayon po, ginagawa natin with the modeling estimates that we did and provided for us to do decisions and policies, can we say that even with this kind of threshold, yung sinasabi natin, meron talagang mga errors, that is a fact and that is reality for all of us in the health community. But can we safely say that with this margin of error that we have, nagamit po natin ito dun sa estimations natin for faster, ito po yung binibigay natin, and ano po yung reliability naman itong estimates natin, because people are saying now that we have incorrect data.
So, I think it's very important, when you say incorrect data, ano sinasabi mo? Lahat incorrect? Kasi hindi lahat incorrect. In fact, kaya pag nag-validate ka, alam mo anong portion ng data ang correct or valid, tas anong portion yung may problema. In fact, I'm not even going to say completely incorrect. Kasi yung iba, may kulang lang. Tas yung iba, clearly, may conflict between, I'll give you an example of a conflict. Like, hindi magkasundo yung city saka yung region. So if you find a conflict, what you do is you bring it back so that it can be corrected. Pero some errors, hindi mo masyadong kailangan. So for example, I'm modeling NCR. Nagkaroon ng conflict in data in the Visayas. That doesn't affect my NCR forecast. Okay, one. Second, so kung may konting less than 1% error, you still have 99% data that is valid and correct. And if you have 99% of the data that is valid and correct, that gives you a lot of evidence for continuing analysis, and that makes your conclusions and recommendations valid. That's the way it works. Parang yun eh.
Thank you, Dr. Amaya. Dr. Arina, you like to add on to that?
Yes, no. Aside from that, at the modeling level naman po, nagpo-produce din po ito ng accuracy results, as I've mentioned before, and we make sure that we show that number to our users. Na for this day po, ang accuracy ng model natin ay 98%, and then pag bumababa po siya, tinitingnan po namin saan nagkakamali, alin po ang part ng dataset na kailangan ulit i-review. So it's an iterative process. It's not a one-time final model, and then you can make conclusions out of it already. So every day, all the cities and municipalities, we update the model based on the data that comes in, and then at night we do what we call model fitting, para po meron tayo nung score na yon, yung ating sinasabing validity score or reliability score. Para po at least meron tayong parang confidence to use the data for decision making.
Thank you, Dr. Rina. Back to you, Carlos.
Thank you po, Yusek. So, considering those po, Dr. Maya and Dr. Rina, what challenges do data scientists encounter and what actions do we take to preserve data integrity?
Okay, I think for the data science community, again, first and foremost, the data science follows a pipeline. So from data collection to data cleaning, and then modeling, analysis, and then visualization, and then data narration or storytelling. So malaking grupo po dapat ang kasama pag gumagawa po ng data science, especially if the model is going to be used by the country. And the group on data analytics is a big group where we have a lot of experts. So first and foremost, I guess yung expert validity, no? Now, all our models that we present are always discussed and checked and verified by the experts. Second, I guess is for the data integrity is we follow science and how data is used in research when we produce our models. So again, it may not be a good model today because the data is not complete, but it does not mean that it cannot be useful. Like all other real-time modeling, the models are updated based on the data that comes in. Now, the behavior of COVID is new. It cannot be predicted 100%. So sometimes mag-a-adjust yung model, sometimes babalikan yung data. So ganyan po yung buhay ng mga data scientists.
Thank you, Dr. Rina. Dr. Maya?
Okay. When we're looking at the results of analytics, as Rina was explaining, there are two potential sources of, well, there are two things we need to fix, di ba? Yung isa, do we have enough data to analyze so we can get good, valid conclusions, right? Yung pangalawa, gaano ba ka-valid yung model natin? So yung validity ng model, that was part of what Doc Rina was explaining. Paano natin siya continue to check, especially versus the data, developing data to see whether the model is actually reflective. But the other thing that we're really talking about right now is how are we managing the data? So one of the things with all of us who work for data, yung first important thing sana nako-collect natin siya quickly and correctly. But we need to take into account the fact na iba-iba yung situation nung nagbibigay sa atin ng data. So, pag nagba-validate kasi, as Dr. Rina said, you can validate at source or you can validate pag nandun na siya sa database, bago siya pumasok sa database or after nakapasok na siya sa database. Right now, in order to get the data complete, nagba-validate tayo ngayon na after nakapasok siya sa database, di ba? Pero that database is provided to everyone. The second important thing is that you have enough data points. So marami kang data points para ma-validate mo siya. Example, alam natin pareho kung kailan kinulik yung sample versus kailan siya na-release yung data. So maho-compare mo siya. Tapos yung location, hindi lang tinitingnan natin anong region. Tinitingnan natin anong region, anong province, anong city. Pwede mo yun ma-compare. So that's the other thing we do is we get enough data so we can do some validation. So yun yung mga the challenges are both the collection and the validating, and there are ways to address them both.
Yes, and I think right now, there are improvements in the data collection system that the Department of Health is providing for our LGU. So, ang challenge po dito is, do we relax the data entry para po mabilis makasubmit, or do we restrict it para less po yung error? So that's also a balance that needs to be taken into consideration when they enter the data into the system. And so that's where the focus right now, I think, is on that part, that we have a system that allows for correct data entry. So we correct it at the source na po.
Okay. Thank you, Dr. Rina and Dr. Maya. That was very enlightening po. So, Dr. Maya, kanina po you mentioned that we make the data available to everyone. So, in what ways are we promoting transparency po in data sharing, and how have we so far enabled the public to access the data on the COVID-19 situation?
So, you know what, I'm weirdly fairly active in Facebook because I have a lot of students who are on Facebook. And for a while, I was actually posting the statistics on COVID, and I stopped because I said that the Department of Health actually has quite nice trackers. So if you go to the Department of Health, not only will you get the statistics as they happen, and it's updated daily, you actually have charts, my charts. You don't even have to actually read the numbers. You can see the charts, you can see the patterns. Third, you can actually, if you're a data scientist or if you're a data geek like me and Rina, you can actually do the data drop. You can click and you will get the detailed data, and you can have fun with it as much as you want. So you can actually go all the way to the detailed data. You can go from visualization to just the bare updated statistics. You can get it by region. You can get it by province. So ano siya, there is a level of granularity available to the public mismo on the Department of Health website to the level you want to get it. Yun. So, did I answer all your questions?
Yes po. Yes, ma'am. Dr. Rina, would you like to add po?
Yeah. Bale, back to back yung Department of Health tracker and Faster. Faster is not publicly facing because it has a lot of sensitive information which is used for decision making po at the LGU level. And so it does not only include health data, it includes security data, socioeconomic data, lahat po ng modeling na we try to put in models po for decision making talaga. And so, but within the dashboard itself, we also provide access to what Doc Maya has mentioned, files that can be used, so downloadable files po for further analysis kung kailangan po nung aming mga LGUs. So, ganun din po, we use the same data from the DOH facing site, and that's what we use in our models.
Carlos?
Yes, Yusek.
Dr. Arina and Dr. Maya, based from your experience in handling the data of DOH, since you say that you review it every day, may question po kasi dito sa chat group natin galing kay Caroline Bonkin, and sinasabi niya, how delayed are the data published? Like yun daw pong nakikita nilang data from Cebu na nasa COVID tracker, at saka LGU data, parang at least 2 days bago raw nasasama ang cases. So do you get the same experience also? And can you explain, ma'am, as you review our data day to day because of your updating of your modeling, how valid and how does it affect our modeling and estimates?
Okay. So ma'am, we've started deploying na po, training our regions and our LGUs, at dun po namin nakaka-receive nga po kami ng ground at saka po yung data ng DOH, and we've always provided DOH with this information na iba po yung bilang sa baba dito po sa lugar na ito. But in relation to comparison, sometimes the numbers are very small that it will not affect the results of the model. There's also a possibility that we can do a separate modeling per region based on the data that they have, but it really depends on the planning, on how to do that. But ang delay po really is kailangan po munang i-validate, I think, yung data, and I hope the Epi Bureau can also verify my statement. What happens is when they submit po, hindi po yan kaagad napupunta dun sa data na pwedeng i-analyze kasi nga po merong chances na meron pong mga missing information na kailangan pa pong i-check. And if you count the number of health facilities that encode this versus the number of people who verify the data, baka po kailangan nating dagdagan para po mas mabilis yung pag-approve or pag-verify. Another option, ma'am, is to already have a way in the system to say that the data that has been submitted is verified. Para po alam na rin ng local kung alin yung data na na-verify at alin po yung hindi. So yan po yung recommendation namin sa Epi Bureau na siya pong nagmamanage nitong system na to.
So Carlos, we're taking note of these recommendations also as we go along with this discussion. Dr. Ramaya, you'd like to add to this statements of Dr. Rina?
Actually, I think Rina basically covered most of it. The other thing lang that I want to point out is when we look at the data naman, we recognize that there are delays. And if you monitor the data, you can get a sense of how long the delay is, so you can account for that when you model.
So, Dr. Ramaya, when you say that we account for delays, no, there is another question here from Greg Gregorio of T5, and he's asking, is there any threshold which is acceptable to say that these delays had been factored in and it doesn't affect any of our analysis? So, ang kanyang specific question, Dr. Ramaya, may we identify a specific threshold that is acceptable as mentioned by our experts earlier? How high or how low is it?
Reset, I think when we talked about acceptability, dalawa yung levels, diba? The first level is, do you have enough data to say it's acceptable? And that's more or less a percentage of the total. So I can get Rina to talk about that. But surely, you don't have to be a statistician to recognize that if less than 1% lang yung na-exclude mo after validation, you still have a fairly good data set. Kasi more than 99%, okay yung data mo. Second, ano ba yung na delay? I think when we look at delays, the question is, are we missing a pattern in the delay? Yung nagkaroon ba ng biglang spike in the last 2 days, for example, of delay? And I think in terms of, so it's hard to say, It's hard to say kung ano yung acceptable kasi depende sa pattern ng disease. Pero here's what I would recommend. I would recommend, and this goes back to what Rina said, that the analytics of this has to be very local, because the disease spread and the outbreaks tend to be very local. So for those of us who are in policy, especially at the LGU level, I think pag may nakita kayo at the LGU level na break in the regular pattern, you should immediately do something about it and maybe work with DOH in order to arrest what's happening and make sure that it gets into the modeling and the response. I think yun yung importante. Kasi yung maganda nga, may eyes on the ground ng LGU, and I cannot overestimate the importance of local government and national government and even the private sector working together at this point in time.
Thank you, Dr. Ramaya. Back to you, Carlos.
Thank you, Yusek. For our next question po, data is usually cumbersome to understand. What are some ways we can simplify it and make it more understandable to the general public?
Okay, I think for those who are connected to the Viber group of DOH, they have a very nice way. They have a very nice way of explaining the concepts. And I think that's very important, no, to have a reference point for all the definitions. So every day po nagpa-publish sila ng mga updates. Ngayon po meron na sila ng situation report every day din po na gine-generate. And so that it's a starting point, no, in order to understand all these concepts. Maganda rin po sana if there is a parang single source na website also for all these definitions, no. Right now I think I'm only aware of the Viber group where millions are already registered. So marami po kasing variables na ginagamit, no, sa pag-analyze ng data. Marami po ang data dictionary ang tawag doon na tinitingnan at kinukuha po namin kung alin yung importante for the modeling. But I do agree that we should maybe provide publicly accessible, laymanized definition of these things.
Thank you, Dr. Rina. Dr. Maya, would you like to add to that po?
My general response to how to inform the public is, first, I guess we should decide which things the public is interested in knowing and what things they should know. And then second, explain it in the simplest words possible. So in their language or dialect. Kasi iba-iba yung ang dami nating lengguwahe, di ba? So isa lengguwahe. Pangalawa, visualization. I think Rina already started with that, na you have to show, minsan mas mabuti instead na numbers, pictures, yung mga infographics, curves. Pero for me, very important is to focus on what's important. Ano ba yung kailangan malaman ng public ngayon? Kasi minsan, nalulunod din tayo sa data. So ano yung most important patterns and results?
Thank you, Dr. Maya. And Dr. Rina, those are very helpful for especially to our media partners as well, since we're not data scientists like you. So we also need help in communicating the data to the general public. And our media partners are our allies in communicating this data to the public. For our next question po, how is data used in government decision making at this critical time, and in what ways is data contingent to healthcare interventions like testing and treatment?
Okay. Sige. If you look at the public facing site, yung NCOV tracker, there are a lot of things there that can actually be used already for decision making. So there are two things that you need to look at. Yung nowcasting, kung ano yung status ng isang lugar today in relation to COVID. And when we say COVID, marami po yung indicators. Yung health indicators, meron din po yung tinatawag nating health capacity. Other aspects po na kailangan din i-highlight, security ng isang lugar, socio-economic status po. So all those things are things that we need to take into consideration when we try to make decisions. So decisions can be at the national level, but decisions can also be made at the local level, depending on the situation. And I think that's what we are providing, no, our decision makers, a tool that will allow them to see data in a different way, that will actually help them understand what they are experiencing today, and maybe provide some forecast also of what they will be experiencing in the future should they decide on certain things. So the platform provides projections, the platform provides nowcasting, what is your status today based on accepted variables that we measure, and also what will be your status in the future should you decide to put in or reduce or relax interventions.
Thank you, Dr. Rina. Dr. Maya?
Currently, the question is what the public should focus on in the data that's available.
How is data used in government decision making at this critical time, and in what ways is data contingent to healthcare interventions like testing and treatment?
Oh, okay, yes. So separately, in policy making, there are in this epidemic, diba, our first most important concern is to make sure that the disease spread is contained. Okay, so and second, we want to make sure, especially, that the disease is contained to the level that the healthcare facilities can manage. Because the thing that we're really trying not to happen is for the disease to swamp our healthcare facilities. Ayaw natin mangyari na hindi na kaya ng mga ospital natin i-treat ang mga pasyente. Yan yung ayaw nating mangyari. Okay? So, as Dr. Rina said, ang tinitingnan ng policymakers is we look at ano yung nangyayari ngayon. Ang disease ba ay paakyat, pababa, o flat? Importante yon. Gaano karami ang may sakit? Pangalawa, given na kung pagtaas yung disease or pababa or gaano karami yung may sakit, ano yung comparison nun versus gaano karami hospital bed meron tayo, gaano karaming ventilator meron tayo. Kasi pag kunyari, marami ng gamit na hospital bed, kung hindi na lang natin ang capacity, kasi mataas yung disease, kailangan yung response mo. Okay? Yung apat, tinitingnan natin yung ability natin we also use the data for treatment, clinical treatment. So, separate naman yun. Yung data for clinical treatment ng hindi ito yung just epidemic data, large epidemic data that we're providing for the policymakers, di ba? Kasi for policymakers, they need to see the macro data. For the people who are on the ground, yung mga doktor, kailangan nila more finer data. Ano yung nag-work in terms of actually treating people, kailan ka dapat mag-test, how quickly do you need to isolate? For example, one of the things that we have now from the evidence globally is that COVID is actually infectious the day before, like 1 or 2 days before symptoms even occur. What does that mean? Ibig sabihin, sobrang importante ng contact tracing kasi kailangan mahanap natin sila even before sila maging symptomatic kasi even before sila maging symptomatic, infectious na sila. Okay? So, yung mas detail yung science na kailangan at the actual implementation and especially at the treatment level. So, we are looking at multiple layers of the data in order to inform both large-scale policy as well as even all the way down to medical protocols. As you can see, this is a very difficult situation. The Department of Health is not only working with the national government and other agencies in order to look at larger policies, they're also looking at all the way to the level of medical protocol at the hospital and clinic levels and paano mag-quarantine, ano yung kailangan for tracing, yun. This is how we're using the data. So, and I want to explain to everyone, when we look at data, we're not just looking at local data kasi depending on what decisions you have to make, yung iba, kailangan tingnan mo yung global data. For example, in the science of treating the disease and how do we know when it's infectious? Hindi Pilipinas lang, titingnan natin ng global data because it's the same virus. Does that help? Yun.
Yes po, that was very, very helpful po.
Depende kung anong kailangan mo.
Thank you, Dr. Rina and Dr. Maya. In your perspective po, what role has technology played in equipping the public to become better prepared to handle COVID-19? Dr. Rina?
When we say technology, it would mean ICT, right? Information Communications Technology.
Yes, ma'am.
For public po, tama ba yung tanong?
Yes
How
po.
is technology preparing the public, no? So first, of course, marami tayong mga media partners who provide information, no, to the general public on what the government is doing and what our private sectors are doing in helping fight COVID, no? So that's one. Every day we should provide the public with the information on different aspects. Maganda po sana kung holistic yung approach natin pag nag-present tayo sa public para po nalalaman nila na hindi lang isang angle tinitingnan si COVID, no? Marami pong angles na tinitingnan which may affect their daily lives now and in the future. So I think ICT provides hope because there's transparency in the work that we do, and the public can access that through ICT. So I would recommend that the public also look at the DOH tracker, because it really provides good information on the everyday parang output, at least of the activities in relation to COVID. But also look at global reports, because sometimes we also reference, no, sila yung nauna, and then we sometimes look at their experience, and then and also use that in our decision making. Also, I guess maganda rin po na yung ibang sectors na rin can help out by providing info campaign po to the public. Mahaba pa po itong crisis natin at marami po pong tulong na kailangan in different aspects, no? So I agree, we should use technology, ICT, to provide the public with some guidance and some hope, and inspiration, no, to help out in fighting this crisis.
Dr. Maya.
Okay, so ICT in particular, no, kasi obviously there are other technologies that are helping us fight the disease better. Multiple layers yung dealing with the crisis, kasi on the one hand, we want to make sure we're educating people in terms of ano ba yung tamang social hygiene, paano ba gumamit ng PPEs, kasi pag hindi mo ginamit ng tama yung PPE mo, even yung mga tao na lumalabas lang, hindi nila alam isuot ng mask properly, pwede silang magkasakit. So one way is to provide correct information down to the level of the people who want to protect themselves. How do you know when you are potentially sick with COVID? What are the symptoms? What should you do? So for me, that's one of the most important things we need to do now, is to make sure we give the public enough information to protect themselves, what they should be doing, what they should do. Nasaan yung pinakamalapit na COVID center yan? Second, it's good for them, of course, to know what's happening. Kasi kung nandun ka in the middle of an outbreak, dapat mas cautious ka. Third, I think it's important for us to understand that there is also the layer of economics, diba? So it's important for ICT has been important in being able to tell people what help is available. So nakakatulong yan sa pagsabi sa mga employers na meron palang SSS, meron palang assistance coming from DOL, importante yon. It's also important for employers now that we're in a period where some localities are moving out of ECQ into GCQ. Importante din for the employees to understand ano yung kailangan nilang gawin to protect their employees. Kailangan din maintindihan ng mga transport operators anong gawin nila pag ngayon na pwede na silang mag-operate, kasi kahit pwede na mag-operate, meron pa ring disease na kumakalat. So kailan pa rin natin i-protect lahat ng tao. I think yung importante ngayon is that all of us, and for me, it's important to remember, yung technology, it's neither good nor bad, it's how you use it. So importante that we use this technology in order to disseminate the correct information. I think for me, yun yung pinaka-importante. We need to disseminate the correct information to the correct people.
Thank you, Dr. Maya. Aside po from technology being used to equip the public and prepare them to handle COVID-19, I understand technology has also been used po, diba, in making it easier for our LGUs to in terms of our data collection process, to make it easier for our LGUs to submit their data, our hospitals. And is this something that you would want to discuss po to our media partners, how we're using the different apps to collect the data, such as the COVID Kaya app? And aside from these apps, what other interventions are being done to further improve the quality and speed of our data collection and processing?
Okay, I'm not in a position to actually maybe discuss this in greater detail, but I know that the ICT is overseeing the ICT component of this fight against COVID, no? So there are apps that are being reviewed, and eventually they will probably announce what these applications are, which can be used by the public, so from the home and also at the city health level and hospitals, and moving up to the regions and national agencies, no. But I do know that they have approved certain applications which really will focus now on the next phase, which is contact tracing, no. If we are relaxing our community quarantine kasi, importante, of course, sabi na po, na ma-identify natin kaagad itong mga infectious people which we cannot determine right now, no. So ang contact tracing po will actually help us in determining it, because you will be reporting your symptoms, and if they see visually, so this is where the dashboard comes in. If they see visually that there's a cluster of reports in a certain area, baka po doon merong outbreak at doon po pwedeng mag-focus ng testing. So isa po yun sa parang example na pwedeng gamitin for the ICT tools now. And then hopefully in the near future, maglabas po ang DICT ng kanilang parang architecture on the different systems po na ginagamit for the country.
Thank you, ma'am. Dr. Maya, would you like to add to that info?
Okay, so and again, I don't have all of the details because I think there's another group that's working on this, but I am aware, as Rina said, I think the intervention STEM start with better data collection at the hospital level, so an app that makes it easier to get the data into the databases. Second, applications that the public can use in order to make contact tracing and disease surveillance easier to use. There's also for the researchers use of third-party source data such as Google Mobility. Fourth, ICT is also used for purposes of helping people access what medical information and medical advice. So meron na nga yung mga app na nire-recommend ng DOH. There are DOH partners na pwede kayong mag-seek ng medical advice online, because I know that there are a lot of people that syempre don't want to leave their home kung gusto lang nilang may makausap na doktor. Okay? There are also apps that allow you to find ano yung pinakamalapit na medical facility that will protect you. So for example, if you are a pregnant woman and you need to get a test done, there are actually facilities that will accept only pregnant women for a few days a week, and there are apps that allow you to find those. So, yun. I think nandun na talaga tayo sa point that disease surveillance becomes important, but also the ability of people to continue to live normal lives while social distancing. So yung mga apps that allow us to continue to talk to doctors while social distancing, those are important.
Thank you, Dr. Maya. So, those are all our questions for today's discussion. We will now be opening the floor for our media partners to be able to ask their questions. There's a follow-up lang po from the question kanina of Kylen Bonkin. With the explained process of data cleaning, case validation on data from LGUs, how long is the average timeline before the LGU data reflects on the DOH COVID tracker?
Which data?
Sorry.
A question po that I think would be better answered by the DOH side. But if you would have an idea din po, Dr. Rina.
Okay. Opo. From our end po, it really depends on the LGU's capability po, no? So again, balikan natin yung data entry kasi yun yung unang challenge, no? Paano tayo makapag-encode ng mabilis at tama? Isa pong challenge is internet connection, no? Even since 2012, yan na po ang problema, kaya nga po mahina ang adoption ng ICT sa ating healthcare. Mabagal po yung internet, mas gusto na nilang mag-treat ng patient kaysa mag-encode ng data. So isa po yun sa factors na kailangan natin tingnan. So hindi po siya pwedeng sabihin na on the average 2 days, 3 days in general, no? Mahirap pong magbigay ng specific number kasi meron naman pong karamihan na instant po yung data. So for example, for the deployments that we've done, we've probably received tatlong regions na nagsasabi na hindi pareho yung data. But the rest did not complain naman. So again, yung challenge, tingnan natin umpisa sa data entry. No, kailangan bigyan natin ng focus 'yon pag nagtatanong tayo on the delay. Doon naman sa pagdating na ng data, so nakapag-enter na sila, no? Tapos noon na-submit na 'yon at transmit na natin. Tapos nandito na siya sa server kung saan ginagawa yung data cleaning. Yun naman po ay automated process. So ibig sabihin, sa tulong po ng ating mga partners tulad ng Thinking Machine at yung data science community rin po ng UP, ng Ateneo, kanya-kanya po kaming parts na tinitingnan para po ma-clean yung data. We know the pattern of data submission, so we've already provided scripts for that. So it does not take a day. So what we've been saying to our users is pagpasok po ng data sa amin, at night po, we generate the models, and then in the following day po, nagagamit na po yung dashboard with the data that came in from the night before. So ganun po yung process natin sa pag-explain about the delay.
Thank you, Doc Rina. Dr. Maya, is there anything that you would like to add din po?
Actually, I can't speak to what validation goes on within the EPI Bureau, but I know they do some validation. The other thing that I think is important to know is when the researchers outside of the Department of Health find questions, we actually go back to DOH or EPI Bureau and say, we found this, please explain it to us. And then kung kunyari missing lang, we say, kaya pa ba to i-fill in? So it's you're constantly making sure that the data becomes as complete as possible.
Thank you, Dr. Maya. There are also a few questions here, I think, directed for Yusek Uset. Yusek, are you still there?
Yes, I'm here.
Okay. Yusek, there's a question lang po from Gerard Naval. To which factor do we attribute the high recent number of recoveries in a day? And on the other hand, the number of deaths have been considerably lower in recent days. Where can we attribute this as well?
Can you repeat the first question?
To which factor do we attribute the high recent number of recoveries in a day?
Okay. Naipaliwanag na namin to dati, no? Sinasabi natin, ang isang tao para maka-recover siya, meron siyang kung naka-hospital siya, ang average natin ngayon is 15 days, no? Yung ating sa isang hospital, pagkaka-hospital ng isang tao na may COVID-19, and that's just the average. So after niyang ma-hospital for that certain period of time, we still need to have another quarantine period of another 14 days. And for us to tag a person to be recovered, we need another test that will verify and certify na siya ay negatibo na. Kailangan tapos din niya yung kanyang quarantine period na pagkatapos ng kanyang admission. So, it might be na yung ating mga ipinasok na mga kaso since a month ago, ngayon pumapasok lahat as recovered. That's one. The second, gumagaling na tayo sa pag-manage ng sakit na ito. Hindi ko naman sinasabi na hindi magaling ang mga doktor natin. Pero as we move along with this pandemic, our doctors now know mas madami silang nagagawa na at mas appropriate na ang nagiging management of our cases because mas marami na tayong kaalaman ngayon as compared before na talagang nagulat lahat ang medical community with this disease And ngayon, while we manage it both outpatient and inpatient, mas nakakaagapay na tayo sa panggagamot ngayon ng ating mga individuals and patients. So I think that's those are the factors that we have. That's why recoveries talaga ay tumataas na ngayon compared before.
What about the deaths daw po, Yusek?
Ano ang deaths?
What factors can we is the reason for the low number of deaths in recent days?
So yun din ang sasabihin ko, no, that our doctors are really getting para bang acquainted with this virus, and they know now really what to do and how to manage. Kasi tandaan natin, walang gamot dito sa sakit na ito. Tandaan din natin, walang bakuna. So ang ating mga doktor, kapag dumadating ang mga pasyente sa ospital, they do symptomatic or supportive management. Pag may lagnat, yan bibigay natin. Kapag may ganito, yan bibigay. Pero ngayon, with the evolution of all of this in science, alam na ng mga doktor natin kung paano i-manage itong mga pasyente natin sa ospital. Therefore, mas kukunti na ang mga namamatay kasi namamanage na ng maayos.
Thank you, Yusek. There are a lot of questions here po, not related to the data, but maybe we can maybe ask our media partners to ask questions related to the data, since we already have our experts here po. For the questions not related to the data, we can ask that to Yusek maybe later. But for now, there's a question po from Carmela Fonbuena. The DOH has more data than it shares to the As mentioned, the DOH has more data than it shares to the public. The tables DOH released in the first weeks of the outbreak included the date of onset of symptoms for each of the country's coronavirus cases. Did the DOH continue to collect this data? I wonder po if that can be an alternative data we may plot to show the country's infection curve.
Yes, I think again, no, we go back to the data collection, no. Marami pong occasions after the first set, no. So nung dumadami na yung mga confirmed, medyo bumabagal po yung pag-enter ng data, tapos na may miss out po yung date of onset, no. And so it has been addressed already. So yes, hindi naman po nababawasan yung kino-collect na data. Ang system po, nandyan po. Ang problema po natin talaga at ang challenge is dun sa encoding part. So yun po yung lagi kong binabalikan, yung source ng data bago po ito pumasok even dun sa verification process, no? So when we had the first wave, lahat po ng health facilities ay challenge, no? So they have to balance between encoding and treating. So when they do the treatment, sometimes po na may miss out yung mga important details. From paper-based po, ini-encode po yan doon sa system, at sometimes doon po yung challenge kung hindi po na ilalagay yung mga data na yon. That's why isa po yan sa verification process na kailangan pong ilagay in place, na mailagay po itong mga very important variables to also improve our analysis.
Thank you, Dr. Ina. Are there other questions po from our media partners that are related
Carlos?
to data? Yes, you said.
Carlos. Oh, it's already 10:38, so we just requested from our experts 1 hour from their busy day schedule. So baka we might want to end this already. All of these questions from the chat box, as well as the questions submitted yesterday or last night to us, will be responded to and sent to them through our Viber group na lang. I hope that's okay for everybody. So tatapusin ko na po, no. We are sorry that we cannot accommodate the question and answer portion for today. We will have another forum. I don't know when the schedule is, Carlos. You just need to inform all of our media partners. But we would like to thank Dr. Rina and Dr. Maya for giving us this time with our media partners. And hopefully, our media partners would have more sense of how we do data, the processes, how we apply it, at kung ano po yung valid, ano po yung reliable, ano po yung accurate. Sana po na ipaliwanag ng maayos ngayon. Ulitin ko po, kahapon, we had our provider for collecting data, no? This raw data that we have, they are the thinking machines. Pinaliwanag po yung proseso natin para sa ating pagpoproseso ng ating datos sa pang-araw-araw. Ngayon po, ang ating mga bisita, si Dr. Rina and Dr. Maya, has helped us explain how we apply this collected data dito po sa mga models, sa mga estimates na ginagawa natin para makapag-desisyon po ang ating mga executives at makagawa tayo ng polisiya galing sa kagawaran ng kalusugan. So hopefully it was informative for you. Kung meron pa ho kayong karagdagang tanong, kung meron pa ho kayong karagdagang tanong aside from the data, just send it to Carlos and we will try to respond it through our Viber group. So, gusto lang ho namin i-emphasize how valuable data is, how important it is, and this is the evidence that we use for us to move forward through this pandemic by using it with our policies and especially on how decisions are made. So, napaka-importante, hindi ho namin pababayaan na gumagamit tayo ng datos na hindi accurate at hindi valid. Meron ho tayong mga katulong ng mga data scientists para magbigay alam para sa amin kung ano ang tamang datos at kung ano ang hindi tamang datos. So we will have another forum of this kind and another forum to answer all of your queries also. So thank you very much again, Dr. Rina, Dr. Maya. Maraming salamat po. Thank you and we'll see you again for our next media forum. Thank you.
Thank you, Dr. Rina and Dr. Maya.
Salamat. Thank you po.
Thank you po.
Thank you.
For the questions sent by our media friends here po, we'll just answer these questions separately and then send the document within the day. We'll also send the recording later.
Sir Carlos, hello po.
Yes, ma'am.
Sir, baka po pwedeng maihabol po yung recording kahit mga lunchtime so we can use it for our newscast kasi medyo late na po yung hapon, sir.
Yes po. We stopped the recording already, so nagpa-process na po siya. It usually takes like an hour. So maybe, probably by lunchtime we'll be able to give it to you already.
Sige po, sir. Thank you so much.
Thank you. Are there other concerns po that anyone wants to raise?